Bueno, ahora sí, buenas noches a todos, buenas tardes también. Soy Félix Suárez, editor en jefe de Editorial Amolca. Les hablo desde la ciudad de Medellín, Colombia, donde está la casa matriz de la editorial. Y hoy estoy muy contento y honrado de presentar a la doctora Dania Tamimi, una autoridad mundial en el área de la radiología oral, autora de obras de referencia para todos los especialistas del mundo, y que hoy ha querido presentar su libro, editado en español por Amolca y que fue titulado en nuestro idioma como La articulación temporomandibular y los trastornos respiratorios del sueño. Dr. Tamimi, welcome. It's a pleasure to greet you. How are you? Your mic is up, Dr. Tamimi.
Encantada.
Encantados también, Dr. Tamimi. The team at Amolca is very pleased to have you with us. We truly appreciate that you accepted our invitation to share with your Spanish-speaking colleagues. I'm sure that this presentation will be very valuable for them. I'd like to let you know that some of your colleagues are joining us from every Spanish-speaking country in Latin America. People from Argentina, Guatemala, Colombia, Mexico, Peru, Spain. You will have a good audience today.
Bueno,
Good. Y bueno, quiero, pues antes de comenzar, quiero explicar brevemente a los asistentes cómo estará organizado este seminario, que hemos titulado Cómo mejorar la práctica odontológica con los aportes del libro, la articulación temporomandibular y los trastornos respiratorios del sueño. En primer lugar, leeré una breve semblanza profesional y académica de la doctora Tamimi. Luego se reproducirá la presentación de la doctora. Aclaro en este punto que la doctora Tamimi nos envió esta presentación hace unos días para que podamos subtitularla, pero ella estará mientras se transmite la grabación. Y bueno, después de que finalice la grabación, tendremos una sesión de preguntas y respuestas. Esta sesión de preguntas y respuestas estará a cargo de dos doctoras muy amigas de esta casa editorial y que muy gentilmente nos acompañarán también en este evento. Hago un paréntesis en este momento para saludar a las doctoras Ivonne Barrero y El Arango. Gusto saludarlas también, doctoras. ¿Cómo están?
Félix,
Buenas noches,
buenas
Félix.
noches a todos. Aquí felices de estar acompañando a la doctora Dania, a la doctora Dalsa, a todos los participantes y por supuesto a Mulca.
No,
Muchas gracias, Félix. Muchas gracias a Molca por la invitación para acompañar y apoyar este webinar de la doctora Tamimi y el lanzamiento de la segunda edición de su libro.
sí, muchísimas gracias también. Y bueno, yo les quiero comentar a los asistentes que las doctoras Barrero y Arango quieren conversar un poco con la doctora Tamimi después de la presentación, hacer unas preguntas, pero si ustedes desean hacer preguntas también, las doctoras las leerán para que la doctora Dania las responda. Ustedes pueden hacer esas preguntas en el chat que tenemos disponible en la sala durante la presentación. Y bueno, las doctoras muy gentilmente harán las preguntas para que la doctora Tamimi pueda responderlas. Bueno, entonces no quiero hacer más larga esta presentación. Yo quiero, bueno, comenzar haciendo la presentación de la doctora Tamimi. Comienzo diciendo que la doctora Dania Tamimi es graduada en odontología en la Universidad King Saud, Riyadh, Arabia Saudita. Se formó en la Escuela de Medicina Dental de Harvard, donde obtuvo el doctorado en ciencias médicas y el certificado de fellowship en radiología oral y maxilofacial en 2005. Es diplomada por la Junta Americana de Radiología Oral y Maxilofacial y miembro honorario del Royal College of Physicians and Surgeons. La doctora Tamimi es revisora y miembro del comité editorial de Oral Surgery, Oral Pathology, Oral Medicine and Oral Radiology. Además, ha sido revisora en múltiples publicaciones en los campos médicos y odontológicos. Es la autora principal de los libros Specialty Imaging Dental Implants, también de Temporomandibular Joint and Sleep Disorder Breathing, y también es coautora del libro Diagnostic Imaging Oral and Maxillofacial. Y bueno, nada, yo quiero darles de nuevo la bienvenida a todos. Dr. Tamimi, thank you for being here with us. We will broadcast your presentation and then we will proceed with the question and answer session with Dr. Barrero and Dr. Arango. Y bueno, nada, aquí está la presentación. Ya la ponemos en breve.
Buenas tardes, amigos. I'm Dania Tamimi. I'm an oral and maxillofacial radiologist from Orlando, Florida, and I'm very happy to be here today to talk to you a little bit about a project that I am very passionate about, something that I poured my heart and soul into for many years, and that is my book, the second edition, Specialty Imaging, Temporomandibular Joint, and Sleep Disordered Breathing. This book, to me, is really an accumulation of a lot of knowledge, not just mine, but also of my mentors and many of my colleagues who are very passionate about the field of temporomandibular joint and sleep disordered breathing. And I would like to show you how to use the book that I have authored and edited, because it may seem a little bit overwhelming when you first receive it in the mail and you're like, oh my God, 1,000 pages or 1,200 pages, that is a lot. How am I going to read all that? And how am I going to absorb all that? And the short answer is you're not going to read it like a novel. Okay, you're not going to read it from the beginning to the end. This book was meant to be enjoyed. This book was meant to be experienced. It was meant to be an accompaniment to your clinical practice, a way to have a person who is specialized and expert in TMJ and sleep disordered breathing imaging by your side at your coffee table or at your office desk for anything that comes along in your clinical practice, a patient with a condition that is a little problematic pertaining to the TMJ and the airway. And this book is supposed to be your companion, your friend, something that you can refer to on a daily basis, okay? And I'm going to show you how to use that, because it may be a little overwhelming to start off, okay? So starting off with, I would like to thank Amolka for translating and publishing the book in the Spanish language, because now I can reach so many of my friends and my colleagues who do not speak English in Latin America and South America and in Central America and also in Spain. And I would also like to thank Amolka for bringing me on board to give you guys this lecture, to give you a short, concise way, a methodology of using the book, because more than anything, you know, I'm trying to make things easy for you. Okay, I'm trying to give you a simplified manner of referring to a textbook or referring to material that may not be readily available to you or accessible to you where you are right now. Okay, so with that said, we're going to first talk about you know, the English version. This is the English version, okay, of course, because I don't read Spanish. I'm going to be showing you everything on the English version, but of course the version that you have in your hand is Spanish. So first of all, where can you find this book? Let me share my screen and show it to you. Oops. Here we go. So on the Amolka website, you have the book, and you have, of course, oh my God, it's a lot of money. Yes, it's a lot of money, but it was also a lot of time and expertise to go in to put this stuff together. Okay, so this really, thinking about all the time it would have taken you to try to accumulate this knowledge, this is really a deal, okay, to have this companion buddy close to you. Okay, so you can find this on the Amolka website if you search for me as an author. And yeah, and of course you can purchase it if you'd like. And the old edition, you'll also find the old edition, which is I don't think it's here, but yeah, there's an old edition, but you want to buy the new edition, okay, the second edition. Okay. All right, beautiful cover. Thank you, Amolka. I didn't think that anyone can make the cover nicer than the English one, but you did. This is the English one. You can see it's a gray background and pretty much the same illustration, but the Amolka one is more beautiful, I think, more aesthetically pleasing. Anyway, so let's talk about how to use this book, and let's talk about also how to bring it into your practice, how to help you with your diagnosis. Okay, first of all, the book is made out of multiple sections, and I'm going to just show you the sections here. And of course, this is in the English language, but I think some of the terminology is very similar. Okay, of course, TMJ is ATM. Okay, articulación temporomandibular. Sorry about my accent. And upper respiratory tract is your via areas, okay, superior. And then SDB here is sleep disordered breathing, okay? Now, the sections there are multiple sections here, and the most important section that you're going to read, and this is the one that you are going to read from the beginning to the end, is section 1. Okay, section 1, understanding the TMJ and upper respiratory tract. Why is this section important? Because this section contains the basic background knowledge that you need to comprehend the rest of the book, to be able to digest the rest of the book, and to be able also to create a more comprehensive diagnosis for your patient. So I'll show you an example of some of the chapters in this. And by the way, this is the ebook. Okay, so the book, as you can see here, has an ebook as well as a paper book. When you purchase the paper book, there's a small area inside that you scratch off, and you have a code that takes you to the ebook. So this is my ebook in the English version, okay? So here's the table of contents. And as you can see here in section 1, we have several subsections or several chapters. There's a section called growth and development, okay, which is very important because this helps you understand the role of the TMJ in the way that the face grows, and also in the way that the upper respiratory tract develops, okay? And if you want to go into more detail into embryological development, you can also look at it here, okay? Now, things like TMJ effect on facial growth is very important for you to understand that the TMJ is a growth site, and that growth site is responsible for the development of the mandible, of not just the condyle, but the mandible, as well as the rest of the face. Okay, and I'm going to show some images here. This is a cone beam CT, and we can see how the condyle here is viewed on the sagittal oblique and the coronal oblique, and we can see that it's nice and rounded in both of these planes and well centered in the fossa. When this condyle grows properly, it allows the face to grow properly. And this is courtesy of Dr. Kazumi Ikeda from Japan, these images. It allows the face to grow properly in a normal anterior rotational growth, okay? When it doesn't grow properly, when there is destruction of the condyle during growth and development because of, let's say, idiopathic condylar resorption or inflammation or anything like that, infection, this condyle is not going to grow properly, and because it doesn't grow properly, the mandible is not going to grow properly either. So it will have a posterior rotational growth instead of an anterior rotational growth. And this also goes for our patients who are, as we say, class 1s, class 2s, class 3s. You know, class 1s have adequate growth of both the condyles and the mandible. Class 2s have inadequate growth of the condyle and thus inadequate growth of the mandible, and it rotates posteriorly, as you can see, increasing the overjet, sometimes steep mandibular plane, okay? And patients that have overgrowth of the condyles will also manifest as changes in the mandible. So a lot of growth happening in the condyle is going to manifest as an increased growth in the mandible, class 3 malocclusion. Okay. Now, I'm not going to go into too much detail here, but just understand that this chapter here on how the face grows is going to be very helpful for you for understanding the effect of the TMJ on facial growth, okay? So when your patient, whether that patient is an adult or a child, it comes to you with a specific growth pattern, you have an understanding of what possibly happened to them in the past, because some of these growth deficits or overgrowth can be pathological as well. And we're going to get into that soon. We also have a a chapter on the TMJ effect on the upper respiratory tract. It's all connected to one another. When you diagnose your patient's TMJ, it shouldn't just be a TMJ diagnosis. It should be a comprehensive diagnosis that takes you through every single part of the patient's craniofacial complex, including their airway, okay? Because the TMJ, temporomandibular joint disorders, with that reduction of condylar height, bilateral reduction of condylar height due to degenerative and inflammatory developmental changes, will contribute to the clockwise rotation growth of the mandible, leading to retrognathia, obtuse gonial angle, steep mandibular plane, narrowing of the airway due to posterior and inferior position of the tongue, because the tongue is attached to the mandible through the genioglossus muscle, and also changes in the bite. You can have anterior open bites if the changes are degenerative or inflammatory, okay? And it can also shift the mandible backwards. Right, and then of course, when the airway is compromised, let's say a child is a mouth breather because there are large adenoids, or the nose, there's something in the nose, allergies, nasal obstruction due to other pathology, or even developmental issues, the patient is going to resort to opening their mouth, and that's going to change the position of the condyle in relationship to the fossa, the disc also in relationship to the condyle and the fossa, and this may result in dual bite formation if the teeth super erupt. Okay, so let's take a quick look at some of the things here. We have degenerative joint disease of the condyles. With the degenerative joint disease of the condyle, there is posterior rotation of the mandible, and that's going to lead to the tongue being pushed back in and downwards into the airway. Okay, so many examples of this. And like I said, this book is meant to teach you to look for these diagnostic clues. Okay, especially in cases where your patient is, clinically, they look like they have their teeth together. Okay, so it's clinically, they look like their teeth are all together and everything is good, but in reality, their condyles are out of the fossa. Okay, so this book is going to help you look at that. Okay, anyway, moving right along, I'm going to go back to the table of contents and still going in understanding the TMJ. We're also going to talk about function and biomechanics. I'm not going to talk about every single one here right now, but there are many concepts that one needs to understand when you're treating somebody's TMJ occlusion airway, right? The concept of orthopedic stability is a very important concept. Understanding the 4D mandibular movements, and this is a beautiful chapter with videos using the mod jaw tracking system. Okay, concept of tensegrity, how the body holds itself together and upright and with certain integrity, and then also how that relates to the different parts of the body, like the spine, for example. Okay, and this is a beautiful chapter written by Dr. Mariana Roccabado and myself, and this talks about the relationship of the TMJ with the atlanto-occipital joint and the cranium. Okay, so if you ever wanted a chapter that gives you all the information that you need straight from Dr. Roccabado, that has this concept, the tricenter concept of occlusion listed, this is the chapter for you. Okay, then of course we go into the molecular composition of these structures, the condyle, and also the disc and the attachments and all these things, and the biodynamics of the upper respiratory tract. So the understanding of these background information is crucial when you start to look at your patients and try to figure out what's going on with them. Okay. All right, so now the next section, and I'm going to take you back to the sections here. The next section is anatomy, and the anatomy section is very extensive. It's everything in the craniofacial complex that you can visualize on cone beam CT and MRI that have to do with TMJ and sleep disordered breathing, and orofacial pain, okay, some orofacial pain, right? So this is a chapter that you are going to start to use to start to learn how to read your own cone beam CTs, trying to identify the anatomy, because the chapters, these chapters, every single one of them is very detailed in showing every single piece of anatomy. So let's just grab one of them. Okay, so we'll take a look at, for example, the anything. Oh, there are so many things here. Which one do we choose? Let's choose something in the upper respiratory tract for a change. Okay, so sinonasal overview, going over the nasal cavity as well as the sinuses. And there's so much information here. And the beauty of how this book is written is that it's not a paragraph that you have to go through. It's bullet points. So very much how you study, you know, you write down bullet points to retain the information. Okay, every bullet point here gives you a an important point, an important anatomical structure that you need to review. Okay, so yeah, so and then you have the images, the graphic images first with very nice you know, delineations, very nice indicators for the anatomy. And then, of course, we have the radiographic. Okay, so after we go all through all this, we have the radiographic, and it'll take you slice by slice, looking at the anatomy and identifying the structures on these slices. Okay, so yes, it's a very helpful chapter, or these chapters are very helpful when you're starting to learn to read your cone beam CTs. Okay, so that is the anatomy section. We have a section on modalities. Okay, I'm not going to go into great detail with this one, but just because, you know, some of us are not radiologists, a lot of us are not radiologists, right? And we didn't study and we don't like the background information about cone beam CT, the actual modality, or even like the MRI, the ultrasound, how to use these for your diagnostic imaging. We don't, you know, as dentists in general, you know, in clinical dentistry, really the continuing education that is available to you for understanding these modalities is not very much. So this section gives you each of those modalities and helps you understand the background information that you need, how to get the best imaging, as well as some of the older techniques that were used, plain film. Let's say, for example, all you have is a plain film, a panoramic or a Ceph or some other of these plain film projections. This helps you understand what are some of the limitations and what kind of information you can actually get from these plain film modalities. Okay, now the fun part starts. The fun part is this, and this is the section, or all these sections from section 4 to section 10 are sections that you're going to live with. You are going to live with these. What do I mean? All right, so notice that there are diagnosis chapters. There's a TMJ diagnosis, and there are diagnoses of things that are similar to TMJ disorders, okay, such as cervical spine issues, temporal bone issues, and there are diagnoses that are related to the upper respiratory tract, okay? So all of these three diagnosis sections have a lot of chapters in them. This is the bulk of the book, okay? How are we going to tackle these? As follows. You're going to have a patient that comes to you. So let's say your patient comes to you and they have a single clinical presentation. So for example, a TMJ presentation. Let's go back to the table of contents. So going down to the section of TMJ. Okay, TMJ, it's right here, TMJ, clinical differential diagnosis. So for example, they have a problem with their oral opening. Okay, they cannot open their mouth. So what do? We're going to go to this chapter and we're going to look at the common and less common differential diagnoses. For each one of these bullets, there's essential information here that can help you figure out if this is the condition that your patient has, okay? And to supplement this, I also have images. So every single one of these, or almost every single one of these diagnoses, I have an image. I have an image here that represents this diagnosis, okay? So what are you going to do? You're going to now look at these images and see if any of these are similar to your patient's symptoms. Let's say, for example, disc displacement without reduction, okay? So now what you're going to do is you're going to go back to the table of contents, to the section of diagnosis, okay? So you're going to go to the section of diagnosis, which is going to come up right here. So diagnosis, okay? Let's just get, so TMJ diagnosis, and you're going to look for disc displacement without reduction, okay? Disc displacement without reduction. You can also use the index if you want to. There are some, there's an index here with like abbreviations to try to find your, the word that you're looking for. Disc displacement without reduction. So now we're in the chapter. The chapter disc displacement without reduction, you're going to read more information about the disc displacement without reduction. Okay. Now, in the regular book, it's going to look, you're going to have an actual page with images, and it's easier to look at these images in the regular book, okay, in the paper book. But here we have so many images that we can compare to our patient's presentation, or radiographic presentation, okay? So now let's say, if we are going to get a radiographic image, just so many images. The beauty of this book is that there are so many images, just so much visual content that helps you spot exactly what you're trying to find, okay? So disc displacement with reduction, graphics to represent, to show what that is, as well as radiographic information, okay? Similarly, we're going to go back to table of contents again. Actually, we're going to go to sections. Similarly, let's say you have a patient with a sleep disordered breathing risk factor. Let's choose a radiographic differential diagnosis this time. So you have a cone beam CT for your patient, and this cone beam CT shows a soft tissue lesion in the nose, okay? So now we're going to go to the table of contents, to the section 10, where these guys are. Hold on. So section 10. All right, over here. This is section, actually it was section 9, sleep disordered breathing radiographic differential diagnosis, okay? Things like blocked nasal valves, large nasal turbinates, perforated nasal septum, nasal lesion with bony destruction, without bony destruction, and with the bony destruction. You see, it gives you exactly the appearance. So now you can go back and look and see if you see anything that it looks like your patient's presentation. So large nasal turbinates, for example, I'm going to go in here. I'm going to go to the pictures and see if my patient's large nasal turbinates look like any of these. Now, what's the significance of these large nasal turbinates? They can cause a nasal obstruction. They can make it difficult for a patient to breathe in and out through their nose, okay? So we need to identify that, first of all, the reason why they can't breathe through their mouth, through their nose, and they're breathing through their mouth instead. And also to come up with a differential diagnosis so we know what we're going to do for them later. Do we need to send them to an ENT? Do we need to give them decongestants? Or do they need to go to a surgeon to relieve some of the obstruction because of the large turbinates? Or do we do nothing at all? Okay, this chapter gives you this kind of information. Okay, it gives you the different types of large turbinates. And then, of course, as I did with the TMJ, I go back to the table of contents, to the section on diagnosis. Okay. And if I'm going to do, for example, a concha bullosa, I'm going to go to here. the section of diagnosis. Okay. And now I have all the things that happen in the nasal cavity, concha bullosa, for example. I'm going to click that. Concha bullosa is the pneumatization of the turbinate. And now I have many, 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 many examples of what that looks like, and I can confirm the diagnosis from there. Okay, great. All right, everybody. So next thing, the last part, the last section of the book is going to be surgery related. Okay, so imaging of TMJ procedures, the procedures that are done to the TMJ, and the surgical procedures that are done for sleep disordered breathing. And these are really beautiful chapters. I encourage you to look at these. Even if you're not involved in surgery, there are nice chapters because the surgeons that wrote these chapters really are, they are top-notch in their fields, and they have a great understanding of the TMJ and the sleep disordered breathing. So they bring it closer to you so that you understand what's going to happen to your patient if you send them off for a surgical procedure. Okay. All right. So to recap really quickly, you're going to read this section cover to cover. You're going to use this section to learn how to read your cone beam CT and identify the anatomy, because the anatomy is the most important thing that you're going to learn when it comes to cone beam CT. Okay. And then you are going to live with section 4 to section 10. All right. You're going to live with these. So when a patient comes along with a specific presentation, whether it's radiographic or clinical, you're going to find what you think is the most similar to your condition, to this patient's condition. And then you are going to go back to your diagnosis section. And from there, you're going to look and see which one is the one that's closest to you. And then, of course, the surgical part is a very important part of special interest, I think, for most people who are in the field of TMJ and sleep disordered breathing. Okay, right. So that's an overview. That's a quick overview of this book. I hope this was interesting to you. I know that people get very overwhelmed when they get something that's this big and this heavy, you know, and they wonder what they can do with it. Well, you can do some triceps extensions, you know, overhead presses, you know, you can try to challenge your anterior deltoids by holding it, isometric contraction. And you can use it if you're trying to reach the top shelf. It's thick enough to use as a step. If you don't like the content, you can use it for something else as well. Okay. All right. Wonderful. I'm pre-recording this because I know they're going to add subtitles in Spanish so that you can understand exactly what I'm saying, because I do tend to speak a little fast. But I hope that you enjoyed this. I hope you enjoyed this overview. And in the end, the purpose of this book was to make this information accessible and easy for you to find, and to also help you understand that we are connected. The entire craniofacial complex is connected, and that a TMJ diagnosis isn't just localized to the TMJ. There are multiple factors and multiple structures that one needs to consider when coming up with a diagnosis for your TMJ or your airway patient. Okay, one is not independent from the other, and it's all working together to keep you alive, to keep this organism that is you and your patient alive and functioning and having a good quality of life. Okay. All right. So I guess I'm going to come on live after this to take your questions. I hope that you enjoyed this, and I hope to see you soon in the future.
Oh, thank you, Dr. Tamimi, for sharing your lecture. I know that people enjoyed your lecture and your presentation, and I have your Spanish edition book here. So it's very heavy too, but I think people will read with things that going to show with their patients. Doctora Arango, doctora Barrero, ¿cómo están?
Aquí, pendientes, perfecto, aquí estamos listos.
Bien, bien, había varias preguntas. Yo, bueno, quería decirles, la opción de los subtítulos no la tenemos activada. Entonces, bueno, ya vieron que hay varias preguntas en el chat. Entiendo también que ustedes tienen algunas consultas y algunas preguntas que hacer a la doctora Tamimi. Entonces, podría verse si podemos de repente decirlas en español o decirlas en inglés y, bueno, explicar un poco la respuesta de la doctora Tamimi para los
Sí,
asistentes.
sí.
¿Sí?
Sí, sí, nosotros pensamos que hacemos las preguntas en español para que el auditorio las pueda entender y luego ella salió un momentico, ella
Sí.
salió un momentico y ya se conecta otra vez.
Ah, ok, ok, ok.
Ella no está en este momento conectada. Bueno, ella creo que iba a conectar el computador, pero dijo que que
Sí,
ya está volviendo. Pero entonces, Félix, mira, lo que vamos a hacer es, empezamos a hacer las preguntas en español. Nosotros se las mandamos a ella ya, entonces
ok.
ella nos va a dar las respuestas de ellas y nosotros lo que hacemos es hacer la traducción de las respuestas de ella, que ella misma las va a hacer y nosotros le hacemos la traducción para el auditorio. Bueno.
Perfecto, perfecto,
Nosotros
sí.
hemos venido mandándole a ella las preguntas para que ella las tenga preparadas las respuestas y de esta manera pues vamos fluyendo un poquito más fácil para no demorarnos un poquito con el tema de la traducción y de algunos términos
Sí,
que es importante que ella los tenga muy claros. ¿Sí?
sí, perfecto. Bueno, sí, les aclaro, bueno, aprovechando este tiempo en que mientras la doctora Tamimi se conecta, bueno, les presento aquí también la segunda edición del libro La articulación temporomandibular y los trastornos respiratorios del sueño, la edición en español. Vieron en la presentación que la doctora pues había hecho la presentación a partir de la versión digital del libro o de la edición en inglés, pero bueno, la tenemos disponible también en español. Ya volvió la doctora Dania.
¿Ya volvió?
Ya
Sí,
volvió.
sí.
Lo siento, pero tecnología es un poquito loco.
Así es. Muy bueno, muy buen español, muy buen español.
I
Bueno,
just got mixed up with the feminine and the masculine right there. So,
Ah.
bueno, primero que todo, doctora Dania, felicitarla. O sea, realmente es una, I hope you understand. If you don't, please let me know, but I know your Spanish is very good and you understand. Pero primero que todo, felicitarla. O sea, esta es una herramienta demasiado valiosa, muy, muy valiosa. Es extensa, pero esto es lo que hace que para nosotros sea posible encontrar respuestas para la cantidad de situaciones que nosotros encontramos diariamente en nuestra consulta, que también son extensos la cantidad de problemas. I don't know if you understood.
kind of.
Okay. No, just to congratulate you for this valuable tool that help us to diagnose our patients. I know it is an extensive work, but that's what make this incredible book so valuable because it provide us answers to many of the situations we face daily with our patients that also are a lot of problems. So in this way, we have many problems with, so we need many tips, many answers to the many problems we have. So thank you very much. Thank
Of
you.
course.
Congratulations.
And the beauty of it is it's not just me that's writing it. It's so many people who are just the biggest thinkers in TMJ, oropharyngeal pain, in airway, you know. And
Vamos a traducir, parece que se le fue otra vez.
Sí.
Vamos a traducirle a ella lo que ella estaba diciendo. Ella dice pues que lo lindo y lo hermoso de esto es que no es solamente ella una persona, sino que hay grandes pensadores detrás de esta obra, pensadores en cada una de las diferentes áreas que encontramos allí. Entonces hay grandes pensadores en el tema de desórdenes del sueño, en el tema de postura, y eso es lo que lo hace valioso. Que como siempre, el trabajo en equipo hace que los resultados sean muy valiosos. Así que nuevamente, felicitaciones. Vamos a empezar con algunas preguntas. Vamos a hacer la primera pregunta. You have it. We are going to start with the first question, que es una pregunta que yo hago, doctora Dania, y es, nosotros como ortodoncistas, diagnosticamos y diseñamos un plan de tratamiento en nuestros pacientes. Nosotros esperamos cambios definitivos, tanto funcionales como anatómicos y estructurales. Entonces, en su opinión, basados en la biología tisular, ¿cuánto tiempo deberíamos esperar para tomar una nueva tomografía y confirmar que estos cambios son reales? ¿O no deberíamos tomar esta radiografía, este nuevo examen y guiarnos de pronto por la parte funcional y clínica?
Mhm.
I know you have this question. I don't know if you want
You
to.
sent it to me in English. Thank you.
Yes. I know you have it. So what's your opinion in this?
I think it depends. It depends on the case. It depends on the you know the phase of the growth, what it is you're trying to look for. You want to translate and then I'll finish.
Ok, esto depende mucho del caso, esto depende mucho de la etapa del desarrollo al cual nos estemos nosotros enfrentando y, por supuesto, al tipo de patología al que nos estemos enfrentando.
Okay. But more than that, you have to ask yourself, why am I going to get another cone beam CT to confirm my changes? If the
Okay.
patient is functioning properly, they appear properly, they don't have any problems, maybe you don't need to get another image. Is it for academic reasons, or is it because there's something that you want to verify, like an actual problem, like teeth being pushed out of bone or something like this?
Ok, entendido. La doctora Dania dice que realmente si el paciente está, que estamos nosotros viendo que está funcionando bien y vemos que los resultados son evidentes, pues no necesariamente tenemos que enfrentar al paciente a un nuevo examen o a una nueva tomografía, que realmente es muy probable que nosotros tenemos las herramientas para poder valorar desde la clínica la parte funcional y no necesitamos necesariamente confirmar la parte estructural.
Okay.
A menos de que fuera por razones académicas, ¿verdad? Pero pues esta razón, I don't know if you justify to order, of course not, I know, just for academic reasons.
Of course not, we
Yes,
don't
I know.
admit patients for
Of course not. I know. Okay.
But if there's something that is a problem and you need to verify this, then definitely you would
Sí, si hay algo que es un problema y que necesita verificarse, pues en ese caso sí. Pero si no es un problema que necesite verificarse y vemos que se ha resuelto, por otro lado, pues no hay una justificación para ordenarla.
Ok.
Dale.
Ok, bueno, buenas noches para
Naturito,
todos.
naturito.
Doctora Dania, buenas noches. Hay una pregunta que también sabemos que usted la tiene, es que como usted, yo también soy radióloga maxilofacial y tengo una pregunta porque muchos clínicos utilizan la tomografía, la CBCT, para analizar las vías aéreas superiores. Teniendo en cuenta la diferencia de posición en la que se adquiere la tomografía y la resonancia magnética, porque la tomografía se adquiere con el paciente sentado o el paciente de pie, mientras que la resonancia del paciente está acostado. Entonces, ¿ha visto usted diferencias significativas en las dimensiones de esta vía aérea con el cambio de la posición del paciente?
Claro. you know, if you if you move your head, okay, if you are like forward or back, that changes the dimensions of your oropharynx. It's a collapsible tube. Go ahead and say that.
Incluso por la acción de la gravedad también cambia un poco la dimensión de la vía aérea.
Mhm.
Because of gravity.
Well, first of all, when you're in the cone beam CT, depending on your head posture, your airway changes.
But if you compare this with the MRI,
In the MRI, you're sleeping on your back, so there's gravity. And plus, they don't usually put the patient in a natural head posture. Usually they're craned back like this a little bit. So the head is either like this or something. So it doesn't represent the actual airway dimensions. In any case, that doesn't matter because that's not what happens when you sleep. When you sleep, you lose consciousness. In an MRI, you're awake, right? Unless the study was done specifically for sleep. Okay.
Ok, la doctora Dania dice que sí, que efectivamente hay cambios en las dimensiones de la vía aérea superior en la tomografía y del mismo paciente en la resonancia. Asimismo, bueno, en la tomografía porque el paciente está sentado de pie y también va a interferir si el paciente tiene una posición natural de cabeza donde la cabeza está un poquito más hacia atrás y va a cambiar la vía aérea, o si el paciente está en una posición postural donde el paciente va a tener la cabeza un poco hacia adelante, va a cambiar un poco la dimensión de la vía aérea. Ahora también dice que en la resonancia magnética sí puede cambiar mucho la posición porque el paciente, mientras está dormido, el paciente está inconsciente, mientras que en la resonancia magnética el paciente está despierto y esas dos condiciones van a cambiar la dimensión de la vía aérea, sumándole el efecto de la gravedad.
So when sleep apnea happens, you're asleep. You're sleeping on your back and you lose consciousness. You lose the control over the muscles that keep your airway open. And it's not going to be the same dimensions as when you're awake in the MRI. Plus, the airway dimensions change even with the inhalation and the exhalation. You know, so depending on the time of the image, the volumes, you know, are going to be different.
Ok, nos dice que efectivamente, pues como el paciente en la resonancia magnética está consciente, va a tener un poquito más del control muscular, mientras va a estar dormido, pierde un poco ese control y todo esto va a inferir en la dimensión de la vía aérea superior, de la resonancia a la tomografía. Ok, Elcita, no sé si nos quieras colaborar con la pregunta.
Sí, bueno, vamos a hacer una pregunta que es del doctor Osman. We are going to talk about the first question about bruxisms and sleep disorders. You want to answer this question?
Go ahead.
Go ahead in Spanish. Okay.
In Spanish so everyone understands it. Yes.
Ok. Entonces la pregunta es, ¿el bruxismo es un trastorno del sueño o es un trastorno de la articulación temporomandibular? La respuesta de ella es, pueden ser ambas cosas. El bruxismo nocturno es un intento por aumentar el tamaño de las vías respiratorias y puede tener efectos secundarios en la remodelación de la articulación temporomandibular. Por otro lado, el bruxismo y el apretamiento de los dientes relacionado con el estrés, pues como todos sabemos, puede ser un problema muscular o un problema del sistema nervioso central procedente del sistema nervioso o secundario al consumo de medicamentos. Entonces, pues no sé, Osman, si te queda respondido, ella dice que pueden ser ambas cosas. ¿Ya? Ok.
No. El labio paladar.
Ok, vamos a seguir con la...
You're muted. Oh, sorry.
No, ya, ok. Vamos con la siguiente pregunta. You have it also in section 6 of your book. La siguiente pregunta es una pregunta en la sección número 6 del libro. Ella se refiere a los problemas que tienen, los problemas respiratorios que tienen los pacientes con labio y paladar hendido. Ellos generalmente tienen muchos problemas respiratorios debido, por supuesto, a esta fisura que tienen y su deficiencia de tercio medio. Entonces, la pregunta es, ¿existe una característica común de la cavidad glenoidea, del desarrollo de esa cavidad glenoidea en estos pacientes de labio y paladar hendido? ¿O ese desarrollo de esa cavidad glenoidea se da como en un paciente de desarrollo típico de clase 3?
Okay, so first of all, my disclaimer is I don't see a lot of cleft patients. So I don't have a lot of cases where I can actually tell you this is the shape of a cleft lip condyle and glenoid fossa, but using just the understanding of the growth and development of the condyle and the fossa, I'm going to say the following. You can translate that and then I'll
Ok,
continue.
ella, la doctora Dania dice que ella no tiene muchos pacientes, no es, digamos que no es su principal target tener muchos pacientes de clase de labio y paladar hendido, pero basados en la experiencia en el desarrollo de pacientes de estos pacientes, lo que ha visto nos va a hacer algunos comentarios.
Okay. As we know with who have cleft lip and palate, they have problems, many problems, not just
Yes.
with respiration, but also with feeding.
Ajá, sí, ellos tienen muchos problemas, no solamente con la parte respiratoria, sino con la parte de la alimentación también.
Mhm. And that is what will affect the condyle and the fossa. It's not going to be a genetic problem because there is a cleft, because the feeding will be different. So the
Sí.
stimulation of the condyle and the fossa, the fibrocartilage on the condyle and the posterior slope of the eminence will not be as much because of their inability to do what they need to do with breastfeeding or bottle feeding or even chewing or anything like that.
Ok, sí, el problema básicamente aquí no es ese problema genético de una deficiencia de tercio medio como tal, sino el problema en el desarrollo de la cavidad glenoidea y del cóndilo empieza desde el mismo momento en el que la alimentación no puede ser como la esperada en un paciente de desarrollo típico. Por lo tanto, este fibrocartílago y estas estructuras no van a tener la forma que generalmente se va dado a esta parte de alimentación típica en los pacientes generalmente. Entonces, el problema básico no es tanto la parte genética de la hipoplasia o la deficiencia de tercio medio, más que el problema derivado tanto de la parte respiratoria como de la parte de alimentación.
They look like they're class 3s. That's probably why you mentioned it. It's not because they have a large mandible, it's because they have a small maxilla.
Sí.
So the growth of the mandible is not a class 3 growth, and the condyle is very distinctive in class 3s. Cleft lip and palate patients don't have that. They don't have long condyles like they do in class 3 malocclusions or growth patterns.
Ok, no, esto en estos pacientes no es tanto un problema de mandíbula, más que es más un paciente es más un problema de deficiencia de tercio medio. Por lo tanto, estos pacientes no tienen las características de un cóndilo alargado que pueden tener los pacientes verdaderamente clase 3 por un exceso mandibular. Ok,
Ok.
bueno.
Bueno, tenemos otra pregunta de uno de nuestros asistentes que nos dice que tiene un paciente con
ya
problemas no la tiene. La doctora Dania no tiene esta pregunta, ya se la voy a
No.
traducir. Pacientes con problemas, desórdenes del sueño por tinnitus. Pregunta que si el tinnitus está relacionado con problemas en la articulación temporomandibular. Someone is asking that he has a patient with sleep disorder due to tinnitus. Could be related with the TMG?
Okay, it could be, but there are so many differential diagnoses for tinnitus. Have to go down the list of differential diagnosis. One of the reasons can be temporomandibular joint disorders, but you can also have pulsatile tinnitus from like a tinnitus that's more like this, that's more coming from an arteriovenous malformation, some kind of blood vessel malformation. And you can have other types of continuous tinnitus,
zzz, okay, continuous tinnitus, coming from also many different things. You can have schwannomas in the vestibulocochlear nerve. You can have, there are medications that people take that can give them tinnitus. So not every tinnitus has temporomandibular joint disorder. Not everybody who has temporomandibular joint disorder has tinnitus. There's a whole list of differential diagnoses that you have to go through to determine why he has the tinnitus.
Ok, ¿se la respondo? Bueno, mira, hay muchos, la doctora Dania dice, hay muchos diagnósticos para tinnitus, hay diferentes tipos de diagnósticos de tinnitus, hay tinnitus que son más como constantes, otros que no son tan constantes, y hay muchísimas causas para este tinnitus, como problemas arteriales, venosos, medicamentos que toman los pacientes. Entonces, ella dice pues que uno de esos problemas sí puede estar relacionado con la articulación temporomandibular, o sea, puede ser una de las causas del tinnitus, puede ser la articulación temporomandibular, pero no necesariamente todos los pacientes que tengan problemas articulares van a tener tinnitus. No todos los que tengan problemas articulares van a tener tinnitus, ¿sí? Entonces, digamos que es una lista muy larga, dice ella, de las causas del tinnitus. Y muchas, además, tinnitus no es uno solo, sino son muchos también.
And there's a whole chapter on tinnitus in the clinical differential diagnosis section for the TMJ in the book.
Ok, ok. En el libro también hay un capítulo completo sobre el tinnitus y el diagnóstico y las causas. Ok, hay otra.
And we have another question that could Eagle syndrome cause more muscular alterations in the mandibular elevators and can be generated by tinnitus or vertigo?
Okay, I have to look at the, is it in the chat? Let me look at it and see. Alterations, musculares. Of course, I mean, there are many different ways that Eagle syndrome, present, you have, when you turn your head, you can get dizzy. You can get lightheaded, and part of that is because the styloid process is pushing against the vascular bundle. You have the carotid and the jugular very close to where the styloid process is, and if you turn your head, you may occlude it, and then, and that may make the blood flow to your brain just a little bit less, making you lightheaded. Okay. How does it alter elevator muscles? I'm not 100% sure, and I'm getting tired, so I have to start thinking. I have to start thinking anatomically and think about how all of these are connected to one another, and it's not coming to me right now. So elevator muscles. So how do they affect the masseter, the medial, the temporal, the pterygoid, the medial pterygoid, the temporalis? The only one I can think of it comes close to, or a little bit close to, is the medial pterygoid. Yeah, like I said, I have to think about this, but I just gave you the idea of why, a person can have vertigo when they turn their head with the styloid process. Okay. And
está en silencio.
Yeah,
Don Félix, perdón que no me di cuenta, perdón. Bueno, mira, yo creo que vamos a terminar con esta pregunta, Félix, si te parece.
Sí.
Pero vamos a responder lo que ella nos está tratando de explicar. Ella no está muy segura del impacto o el efecto que tiene este síndrome sobre las alteraciones musculares, pero definitivamente, pues ella dice que sí, debido a que tenemos esa cercanía entre los pterigoideos y los movimientos que nosotros podemos hacer. Definitivamente este síndrome puede generar algún tipo de problemas musculares, definitivamente sí, pero no está muy segura de esta situación.
The common things are basically the pain upon swallowing, the pain on turning the head, the vertigo, the lightheadedness when turning the head. That's the most common thing that you'll see with
lo más común es tener un poco de molestia y alteración tanto en la deglución como cuando mueves la cabeza en este sentido. Gracias, doctora Dania. Thank you. Felix.
Thank you, Dr. Tamimi. I would like to congratulate you for your beautiful book. And I want to thank you for having shared this space with us. Y doctoras Elsa, Yvonne, realmente agradecidísimo, muy agradecido por haber compartido con nosotros también con este espacio, con la doctora Dania. Estoy seguro de que los asistentes han podido tener, digamos, también y aprovechar este espacio con ustedes, de verdad. Un placer, doctora Dania, haber tenido el poder estar aquí con usted y que haya compartido con todos sus colegas latinoamericanos en este espacio, de verdad. Y bueno, a los asistentes les quiero decir que, bueno, que tenemos, sí, la edición en español de el libro de la doctora Dania Tamimi, la segunda edición de la articulación temporomandibular y los trastornos respiratorios del sueño. Tienen el código QR si están interesados en el libro. Allí pueden tener información sobre la adquisición de la obra. Y bueno, nada, no me queda sino pues despedirme, realmente agradecer por este espacio. Doctora Elsa, no sé, doctor Ivonne, si quieren aprovechar, bueno, y decir unas últimas cosas antes de terminar.
Bueno, antes de desearles una buena noche, agradecer a Molca por estos espacios tan enriquecedores para nosotros los profesionales de la salud en los diferentes campos. Así que muchas gracias por hacernos parte. Felicitaciones nuevamente, doctora Dania. Un abrazo grande. A big hug for you. Congratulations again. Y bueno, Amolca, gracias. No sé, Ivoncita.
Bueno, yo quisiera como usuaria y como propietaria de uno de los libros, incluso lo voy a mostrar, eso es algo que le había mostrado a la doctora Elsa hace un momento. Yo tengo la primera edición del libro de articulación temporomandibular y la doctora Elsa tiene la
Yo la
segunda.
segunda.
My fan club.
Yes, fan, total.
Total.
Club de admiradoras, total.
Y es evidente que en la segunda edición eh, aparece mucho más específico el tema de los trastornos del sueño, del desarrollo de la vía aérea, que es algo que a nosotros, y lo hablo desde mi punto de vista profesional como radiólogos, nos interesa, ¿sabes? Y que muchas veces los clínicos no logran entender las diferencias entre las las diferencias de las captaciones imagenológicas que podamos hacer en nuestros pacientes. Entonces, de verdad que la segunda edición es absolutamente increíble, espectacular. A la doctora Dania, felicitaciones, un abrazo enorme y esperamos volver a tenerla pronto en estos espacios.
En el país,
Ah, y
aquí
en
en
el país,
Colombia.
obviamente.
Pero esperamos que sí. Bueno, nos
Olga, muchas
despedimos
gracias.
entonces. Muchísimas gracias, doctora Tamimi, and thank you for being here with us.
Gracias, Thomas.
Chao, chao.
Thank you.
Gracias a todos. Chao.
Ciao.